There was a general update on the BRUIN trial in terms of the clinical outcomes, which continue to show very strong PFS benefit of Pirtobrutinib in relapsed refractory CLL patients. I reported on genomic evolution in progressors on Pirtobrutinib, and we have 88 patients who were previously treated with covalent BTK inhibitor who had paired samples from baseline and relapse, and we were able to do targeted sequencing on them, 74 genes. And so we found at baseline that the most common mutations were in BTK in a little over half, and P53 in about half the patients. And then at progression, 68% of patients acquire new mutations. 44% of patients acquire new mutations in BTK. And 2/3 of those had a prior BTK mutation when they came on study. Then another approximately quarter of patients acquired mutations in genes that were not BTK. And 32% of patients did not acquire any mutations in the targeted panel. And if we look at the mutation level, there are actually 138 mutations found in the 60 patients who acquired mutations, and BTK was predominant, with T474 mutations representing 20%. That's the gatekeeper mutation, and L528W kinase dead mutation representing 10%. We looked at the evolution of the allele frequency of BTK mutations over time, and most of the C481 pre-existing mutations are cleared or go down, whereas the 474 and L528W mutations are acquired or go up. We had a more sensitive assay to see if the acquired mutations were present at baseline, and we found that 37% of them were at lower allele frequencies, but that didn't preclude efficacy of Pirtobrutinib in that population.